Hello and welcome. This is the second part of our insomnia video, and today we'll be discussing the medications involved with insomnia. We will be going through over-the-counter medications and herbal products, and we will be releasing part 3, which would have the prescription products in there. Okay, so for the over-the-counter medications for the treatment of insomnia, we really have only two medications that we're going to be talking about today. And these two medications are found in a lot of the preparations that you will see over the counter. So there's a lot of brand names that are going to essentially have one of these two medications inside them. The first one is diphenhydramine. Diphenhydramine is found in Benadryl, Nytol, Xanax, Unisom, both the sleep gels and the sleep melts, and several other products. A lot of the times the stores that you're getting these medications from will have their own brand, store brand, and they would have diphenhydramine in there. So just flip the box over and look at the active ingredients, and if you see diphenhydramine, then this slide would apply. The start time for the sleepiness for Benadryl or diphenhydramine is going to be between 1 to 2 hours. That's what we call onset of action. So we're looking at 1 to 2 hours before bedtime. If you take it, you're going to be sleepy by the time you need to go to bed. It's minimally effective, and there's tolerance that develops quite quickly. Develops after about 10 days of continued use. So the suggestion is every 3 nights, give yourself a night off from diphenhydramine. So that means if you use it for 2 nights, the third one, don't use it and try to sleep naturally. And that'll prevent a lot of the tolerance from occurring. A lot of the side effects associated with diphenhydramine are going to be drying effects. Dry mouth, dry nose, dry mucous membranes. You might see constipation, urinary retention. There is some hangover effect, so when you wake up the next morning, or if you need to get up in the middle of the night to go to the bathroom, you're going to feel a little groggy, you're going to feel a little under the influence. The second drug we're going to talk about is called doxylamine. Doxylamine is found in Unisom sleep tabs, and this is also an antihistamine, just like the diphenhydramine, but it has a couple of very interesting properties. The onset of action is faster, so you can take it closer to bedtime. The onset of action is about 30 minutes. So if you take it and 30 minutes later you go to sleep, that should be perfectly fine. You don't have to wait the hour or 2 hours for it to be effective. It seems to be more effective. It is one of the most sedating antihistamines out there, and so it definitely will have more effect than diphenhydramine for most patients. Tolerance does not develop with doxylamine, so that's another benefit. So now we have a couple of benefits: faster action, more effective, and less tolerance. And of course, the end result is that it's more expensive than the diphenhydramine. It does work, quote unquote, better, and so it's more expensive. The side effects are going to be identical. There's still hangover effects that are actually lasting longer than diphenhydramine because it's longer duration of action as well, and it's a more stronger or more sedating medication. And so you still have the drying, the constipation, the urinary retention, but you now have the hangover effect for up to 10 hours afterwards. And so in the morning, if you have to get up and drive to work, you might actually, have difficulty operating that type of machinery, if you will, heavy machinery in the morning. And so be careful. The herbal medications for the treatment of insomnia, there's a lot of different preparations which claim to have efficacy. We're going to talk about 3 today that definitely have the research behind them, if you will. There's one that I will specifically not mention because we're going to cover it in a separate segment, and that's St. John's wort for depression-induced insomnia. It's actually shown to be effective and safe. So St. John's wort, but because we're not talking about depression here, we're talking about insomnia by itself, I did not include it on purpose into this lecture series. So the first one we're going to discuss is chamomile. chamomile is used most often as a bedtime tea and really is a preparation of varying strength. And it's kind of German chamomile is the actual name for a lot of the packages that you'll see. And it does have sedating properties. Now, having said that, there is no reliable evidence to suggest the efficacy of chamomile for insomnia. So at this point, you're saying, okay, well, he just told me that it has sedative properties, but there's no evidence. Well, yes, that is correct. So if anybody who normally does not have any trouble with insomnia takes it, they may very well feel sleepy. However, if a patient with insomnia takes it, they may or may not feel that sleepiness there. We're going to also try to stay away from chamomile if you have a ragweed allergy, just because the two are very similar and you may have the same allergic reaction. It's going to interact with certain medications that are metabolized through the liver. For those who know cytochrome P450, 3A4 is the enzyme that it's metabolized through. Valerian is the most studied herbal product for insomnia, and it has to have benzodiazepine-like properties. We're going to talk about benzodiazepines in the next segment. It may take up to 1 week to see the effects in some patients with valerian. There's limited morning hangover effect. It's safe for short-term use. Use preparations with 0.4 to 0.6% valerian acid, and if you take 400 to 900 milligrams 2 hours before bedtime, that's the typical dose that's used. It can certainly interact with medications that are also metabolized by the same exact enzyme that we talked about with chamomile in the liver, and valerian is really a safe bet as far as insomnia goes. It's quite active as an herbal product. Melatonin is a naturally occurring hormone, so just to be clear for a lot of our listeners, if you're trying to stay away from hormones in your food and certain other things, melatonin is a hormone. Our body makes it. It's in our body all the time. The darkness stimulates its production. So when it gets dark outside, our bodies make melatonin. And when it gets light outside, our bodies stop making melatonin. And so it works best in patients with decreased melatonin levels or decreased production, especially if you have jet lag, if you flew over to another time zone and you now have to adjust your sleep pattern. This would work quite well. In an elderly population, the melatonin secretion starts to get inhibited, and so this drug is also quite useful for that. Typical dose is 0.3 to 5 milligrams, taken 1 hour before bedtime. If you take it same time each night, it'll get your body onto a sleep cycle, and the hormonal levels will regulate the sleep cycle. You try to use immediate release for falling asleep and extended release for actually staying asleep. So if you're waking up in the middle of the night and you're not sure why, use the extended release. And if you're just having difficulty getting yourself to fall asleep, then use the immediate release. So next we're going to talk about prescription medications for the treatment of insomnia, but that'll be in part 3 of our series. So thank you very much for watching, and subscribe.